We hear the term COVID heroes used a lot, but I'm joined now by three true COVID heroes, healthcare workers who went to work day in and day out during the pandemic. Joining me now are Emily Coulter, who is a personal support worker in a not-for-profit workplace, Jennifer Cloutier, who is also a personal support worker in a for-profit workplace, and Theresa Quinto, who is a registered practical nurse in a for-profit long-term care home. These women have worked through a humanitarian crisis, and we may get emotional. It's so important that we focus on long-term care, where we lost over 4,000 long-term care residents. And tragically, 24 healthcare workers have died of COVID-19 in the last 2 years, and most of those workers have been in long-term care.
Pre-pandemic, we were in crisis, and then the pandemic hit and it got even worse. I'd say that the reason why we were so short-staffed is because we were the only ones there. They kept calling us and we showed up, we went into work, and the people that we would train and that would come into work, or people that are new hires, didn't stay, so that left us taking and filling in the gaps to just show up for work because our residents needed us.
Tell me what it was like when your home went into outbreak.
We were not prepared. We hear about it and you're always thinking, oh, we'll be one of the lucky ones that don't get hit. And we were fighting in the beginning for PPE. I remember having a nurse put out masks every so often on near residents' rooms so that we would use them to go into the room. And then they came in and were like, well, you can't use that. You'll scare the residents. You're not making it feel very welcoming. You don't need it. So we were going by the instructions of what our home was giving us, but it wasn't the correct information. And we still kept advocating for each other and ourselves, because we're in the community. We're the ones going to the grocery stores and pumping our gas. And when we walk into that door of long-term care, we are the ones that have to stop it to protect them in long-term care.
Yeah, you contracted COVID-19 early on. Tell us about that.
I did. I was one of the first ones in my long-term care. There was a few before me, but the conversation was absolutely terrifying. And I remember getting that call from public health, and the nurse was so kind. She asked me if I was sitting down, and I said, oh, and I was sitting down, thankfully. And she said, I'm so sorry to tell you this, but you're positive. And I had heard about a few others at my long-term care that tested positive. So I was just like, I felt so defeated and depleted, and I had to call my coworkers and let them know that I'm not going to be there. I didn't know the effects that was going to happen. No one knows what the long-term effects are going to be when you have COVID. And the conversation was, what's going to happen? And then I isolated, and I was away from my family. That was hard. That was so hard to do, because I have 2 little girls. Explaining to them why mom couldn't come out or why I had to isolate. And I was honestly really angry, because I did fight for that protection to not catch it.
Thanks. I'll go to you, Jennifer, next. Jennifer also worked through a code red outbreak in her nursing home.
On March 16th was our first COVID positive case. Within 24 hours, we had 64 members take a leave. 24 hours. They left out of fear, anxiety, workload, wages, personal and childcare reasons. Some of them, their spouses got moved out of the city with COVID hitting hard then. Our number rose to 92 within 72 hours. We were left with 42 members. And when I say members, building wide, that included my Unifor members, my ONA members, and my management team to run a 24/7, 140 resident home. That's unheard of. It's impossible. Our amount of supplies and staff weren't there. We had a pandemic supply that ministry says of 8 weeks. That was a hard reality of 3 weeks when you're going through the PPE at such a rapid rate. On April 2nd, 2 weeks later, As COVID was taking over our home, I moved into a trailer on our work facility. I had to be there for my members, for support, for encouragement, for staffing. I was very fortunate that I had 2 young adult children at home that could handle the household by themselves. And I was already isolating from them. I have to say I went on 56 days, 809 hours. Let that sink in. 809 hours I went before I got a 24-hour day off living in a trailer in our parking lot. I coped with weather changes, snow, rain, our water froze. We would run out of propane. We would lose power. Disrupted sleep for me was routine for months, not eating properly and pure exhaustion. And it was really teetering with my mental stability. My 12 to 16-hour days turned into 16 to 20-hour days as more of our residents' health declined, as more and more of my team members became positive, or they were leaving. They were leaving the sector. Even at that point, we're talking April, the end of April, they were already leaving the sector. They couldn't cope with it. And I have to say that we had to, as we lost residents, one of my triggers still to this day is one of the things we had to do was beg a body of a resident. I did it 9 times.
I don't think people understand that during COVID, an outbreak, the funeral homes couldn't go actually into the facilities. And so that responsibility fell to the staff and the whole staff, from what I've heard, because many people, even housekeepers and dietary workers, but it's very emotional. These are people that you care deeply about. You were able to get some relief in your city from the field hospital.
Yes.
Can you tell us about that?
So when we were helpless, we were hopeless, we felt guilty, we didn't have the resources, we utilized our field hospital. And it was honestly, it saved lives. And I wrote stuff down because I didn't want to I want you to understand how important it was for us to utilize our field hospital. They had supportive staff levels for our ill complex residents. Their staffing ratio was 1 to 5. Mine was 1 to 30 on a daily basis. Theirs was 1 to 5. And the floor staff in the field hospital were all RNs. Every single one of them was an RN. So that was huge for us. They had a doctor on site every day, every hour. That's huge for timely treatment changes, for medications, for diagnostics. They had real-time treatment there where we have a process in long-term care, and it's very timely sometimes to get a medication change. Residents no longer had to isolate. That, I think, was very important for us. Our residents were isolated to their rooms, so they could roam the hospital freely. And regulations within hospital settings are more reduced and more relaxed. We're very highly regulated in long-term care. As well, they allowed 2 of our team members to assist with a familiar face. Keeping a routine, dining, and completing tasks in a timely manner is quality of life for our residents. So I had the privilege, like I said, to work alongside that amazing field hospital team. Most days I would work 8 hours at the hospital, then come back to the home and work another 8 to 12 hours in the home because we were still short-staffed. We still had 7 COVID positive residents that their families chose for them to stay in the home. They wanted them, if they were going to pass within our home. And also they were very confident and trusted us with the care that we were providing, even knowing the staffing levels and the situation that we were in. The field hospital, though, was an eye-opener for a lot of the field, for the RNs and the hospital teams. The demands, the needs, the individual unique care plans, behaviors, our timely tasks that had to be completed, but they embraced it. They educated themselves. They implemented communication with families, verbally and virtually, activities and programs. They got to know their life stories, put pictures up at their bedside. When I would go in there and report, the doctor would ask me, Jen, anything we need to know? This is the problem we're having with resident so-and-so. What can you help us? Can you maybe go there with one of our team members and see what's going on? A familiar face is a very important part to a resident. The collaboration and hours between both teams and to transition our residents was amazing.
I'm going to go to Theresa. Theresa's home, as a for-profit home, you had an outbreak in the second wave.
It was also very devastating. We lost 17 residents in our home. Also, it was very difficult for me as a nurse to call families and say, you know, your loved ones contracted COVID, and they would call daily asking how they were doing because they were unable, asking, can we come and visit? Are we able to come? And unfortunately, for me to having to turn them away and say, no, you can't at this moment was very hard for them. And I remember when we did lose our residents and I would have to make that devastating call to say, listen, I'm sorry to say, but your loved one has passed. And some had cried so hard that it never leaves you. It's stuck in your mind. And to this day, I can still hear the pain and the agony in their voice, unable to be there for them when their loved one took their last breath. We were there for them. We held their hand. We had one family member said a prayer over a phone to the loved one before they passed. And again, like I said, bagging bodies was very difficult. I had to ask staff, how comfortable are you to come and help me? A lot couldn't do it. I would ask a housekeeper. She said, yes, she'd come and help me. We worked together as a team. We helped each other. And, you know, it's something that COVID is real. It's something that really hit me. And I say to myself, you know what? If this happened to my children, my mother, my father, my loved one, I do not know what they are going through. I will never understand or feel how they're going through.
You made some excellent points about working as a team, because we hear a lot about the nurses and the personal support workers, and your personal support workers and a nurse, but it does, I mean, I know that you've told me about how people have stepped up in every classification, how they rallied, and
Exactly.
maybe you could speak to that a little bit about what.
So we had housekeepers that would help us collect trays because residents were isolated in their rooms. You know, we had anybody would come up and say, do you need help? Is there anything that we can help you with? And as a registered nurse on the floor, I'm responsible for not just taking care of my residents, but taking care of my staff. Going through this is physically, emotionally, and mentally challenging. And I would have to stop and say, are you okay? Do you need time off? Do you need to get off the floor? Because not only am I the one in charge, but I have to also look at the ones who are taking care of them. And that is the personal support workers, who are my ears and my eyes, and that I rely on to make sure these residents are well taken care of.
You lost a coworker, Sheila, to COVID. How did that affect you and your teammates? And maybe you want to say a little bit about Sheila?
I worked with Sheila for over 20 years, and I was at home when I got the call. One of my coworkers called me, and at first I couldn't comprehend what she was saying to me. I was in shock. Coming to work, we were all in shock because she was such a good person. She had a good heart. She took good care of these residents. She understood them. She talked to them. She communicated with them. And, you know, working side by side with somebody for 20 years, and all of a sudden you come to work one day and they're not there anymore. It's a strange feeling. You look for that person. You look for them. She also took care of her elderly parents.
I want to switch the conversation a little bit now. I want to talk about pandemic pay. Unifor, back in early April of 2020, fought very hard for pandemic pay for all workers. And there was some success the first 4 months, not all, but most healthcare workers got a $4 pandemic pay for 4 months. And the people that I've talked to said that was, at least you felt a sense of respect. How would you say that pandemic pay made you and your coworkers feel when you were receiving that for those 4 months?
I'd like to say that it showed some sort of thank you.
Yeah.
Thank
Appreciation.
For the things.
Thank you for leaving your family and leaving your fears at the door and walking in that door to go and take care of, residents that have COVID. Every single person that walks into a long-term care deserves respect.
Yes.
They deserve to get wages as well. And it's only temporary. So you're only worth so much for so long. And then I feel like it hangs over your head that it could be taken away at any given time.
And there is temporary pandemic pay right now. It's only for personal support
Yes.
workers, not in every single setting, but both of you are PSWs and you're getting the pandemic pay, and you have coworkers that you work with. How does that feel for you? Like it
caused a divide. It caused a divide because
Animosity.
there's RPNs that are making less than $1 more than you. Are you saying that our registered staff or our housekeeping that worked tireless hours to get COVID out of the building is worth less? What about the cooks and the FSWs that work, who showed up for work every single day during this pandemic? Are they not worth the wage enhancement?
So we have the temporary pandemic pay for PSWs, and we have a retention bonus coming for nurses. Neither of these are permanent solutions. What do you all think about? Is that going to fix the solutions, these temporary?
No, there's no way. There's so much underlying problems with long-term care and hospitals right now. Throwing some money at the problem is not going to fix it, because it's not permanent, first and foremost. And there's so much cracks in long-term care that we need a solid plan to fix it. We need, we're the frontline workers and we have solutions. Listen to us and show us that respect. So by saying, here's some money, it's not going to fix it.
Emily, I want to ask you specifically, because you work for a not-for-profit long-term care home. You're covered by Bill 124, which limits your total compensation to 1% in every year. How does that make you and your coworkers feel?
I feel like this government lied to us. When you say that you're only worth not more than a 1%, but you're so essential, you're so valuable, you're heroes, but their words and their actions don't match.
We were angry. We said it's not fair.
They have the money to pay all
Yes.
these extra overtime, all these agencies, but they can't find money in the budget to give, let's just say, our RPNs a bump once or twice, or a top up somewhere for our recreation staff that has worked tirelessly to come up with solutions. Every single person deserves something, and they just don't have the money to give.
I want to ask each of you, why have you stayed?
I stayed because they're my second family. That's not just because I work there. It's because I truly love my work as a nurse and taking care of my residents.
So I've been a long-term care worker for 19 years. I have never woke up and said, I don't like my job.
Exactly.
I love my job, even through COVID.
So I'd say the same. I absolutely love my residents. And I mean, they start your day and you start theirs, and there's a relationship built over time, and they depend on you.
Exactly.
If we all
Absolutely.
had the attitude of where I'm not getting paid enough to go in, if we all had that attitude, no one would show up.
Absolutely.
Well, I think I can speak for everybody watching, that we thank you and we're so grateful. And thank you for this wonderful discussion.